Are we ready to start?
Yes, we can start, sir.
Okay. Hello, everyone. Thank you for joining in for this NPTEL live session. As previously mentioned, if you have any queries, please post either. Are we ready to start?
Yes, we can start, sir.
Okay. Yeah, as mentioned, so please post your queries either here on the Zoom meeting, or if you have queries that you posted on the previously on the Excel sheet, we'll take it in a moment. And then there's also a YouTube live session. So you can also post your queries as comments on YouTube. I'm also joined here by another TA that has been helping out with this course, Saksham Jain, who's also here. So what we will do is, I think in the previous live session, a couple of questions were posted a little late after the live session. So we'll take those. And I also see there's one query from the current Google form that was circulated. And then we'll see if there's any other questions that anybody has. So if you have any, please start posting them. So we'll wait once we answer everything, and after that, if there's no queries for 5-10 minutes, we will end the session. So I'll go ahead and go to one of the previous live sessions queries. So one of the query was regarding the core shell type nanoparticle. So I think this was something that either maybe discussed in the class or as a part of assignment, in which a question was given that the radius is a core shell type particle. So there's a shell of a certain thickness, and then of course there's a core. So the radius of the core was given to be about 2 nanometer, whereas the radius of the whole particle, including the shell, was given to be 5 nanometer. And the question was to figure out the ratio of the volumes of the core to the shell, right? So it's sort of pretty straightforward question, right? So we know that the volume of a sphere is 4 by 3 pi r cube. So we are looking at the radius of the core. That's about, because the radius is 2 nanometers, so it's just 4 by 3 pi 2 cube. This will be, of course, in nanometer cube. We don't need to convert any units because we want a ratio, so everything will get cancelled as long as the units are the same. So the whole particle will again become 4 by 3 pi 5 cube. And if you want to find the radius of the shell, then or the volume of the shell, then all you have to do is subtract the whole volume from the core. Whatever is left is the volume of the shell. So then if you subtract this 4 by 3 pi 5 cube from 4 by 3 pi 2 cube, you'll get the radius of the volume of the shell. And then you can divide that by the core to essentially get whatever was asked. So this was asked by Hina. Another question that was posted previously was posted by Nandana, and I think she wanted to know about the exam registration date. So I think that's sort of outside of the purview of this technical live session. I think if you have questions on that, you can email NPTEL team. I think most of the information is available online, so you can just find it on the NPTEL portal. But if not, then you can always email the NPTEL core team, and they'll be able to answer any questions regarding the exam registration dates and registration fees and everything of that sort. There was another question that was posted today. I think this is from Reshma. And Reshma wanted to know about some of the important topics that could come in exam. Again, I think the topics could be pretty much everything that is discussed in the slides. I know there's quite a lot of things that have been discussed in the slides, but the idea here would be to mainly focus on the concepts, and as long as you are able to understand what is being taught and maybe revise it a little bit, you should be good to go for the exams. And the pattern of the questions will be quite similar to the way you've been seeing in assignments, obviously for longer duration. But then the questions will be sort of along the same lines. You will have MCQs, you'll have fill in the blanks, you'll have ranges, where you may have to do some calculation and fill in your answers in a particular unit. Okay, so I think that's all so far in terms of the questions that were asked in the spreadsheet, also through the Google form. Let's see if there are any questions here. So I guess Shantanu has joined. Okay, Reshma, you are already here. So did that answer your question? I know you were asking about the syllabus. Do you have any other query here? Okay, I guess not. So another question is posted by Shantanu, who's saying, please give your opinions on the core shell hydrogel, how it can be utilized in orthopedic implants. Okay, yeah. So of course the any hydrogel that we talk about has to be quite hydrophilic, right? So the that's how we define hydrogels. These are devices, these are matrices that are formed from polymers that can absorb a lot of water, and they could even swell to several folds, several orders of magnitude from their initial volume and from the initial weight. Um, when you talk about core shell hydrogel, again, this is sort of I don't think we discussed core shell hydrogel too much in these slides. But technically, any structure that has a core and a shell over it could be classified as core shell. So if we are talking about a core of a hydrogel with shell of some polymer or another hydrogel, those things are so hydrogels are actually pretty good for tissue engineering when you talk about cell ingrowth, when you talk about how cells can infiltrate, cells can degrade, cells can maneuver it. However, having said that, hydrogels, because they're mostly water, they tend to be quite mechanically poor in their properties when you talk about high elastic strength and all that. So for orthopedic implants, while you can use hydrogels to promote new bone formation into the implant, you will still need to structurally support the bone, either through some kind of a metal implant or something of a harder material like ceramics, bone cements, those things. But nonetheless, the hydrogels do facilitate infiltration of your bone cells, your stem cells to come in and form bone. So you could think about possibly having two sets of implants, where one is hydrogel, which is to increase the bone growth, and the other is separately structurally supporting the bone, so that because the bone growth would likely be quite slow, and so you would want the patients to be able to continue to perform their normal functioning, and so you would also want to support the bone so that the load can be transferred across the fracture site. So you may need some metals, some screws, some ceramics to be able to do that. Okay. Right. Okay. There's another question posted here. Can we utilize these type of hydrogels to replace PMMA beads for localized delivery with metal implant? Yes, certainly. Again, as I said, any hydrogel that you think could result in better bone formation, faster bone formation. There are sometimes critical defects. So if there's a big bone chunk that has been broken down, or there was a big tumor that has been removed, and so if the disjoining area is quite big, those things are called critical bone defects. So which means that they will not join by themselves. So you would need to provide some material, some conduit through which the two ends of the bone can start to reach each other. And so from that perspective, I think you could use any hydrogel to provide that facilitating ECM matrix. You could have drug delivery from there where you can release growth factors. You could release recruiting chemokines, cytokines to be able to bring in more cells that can come in, find an environment to be conducive for bone formation. Can it replace PMMA beads? I mean, sure. I mean, it depends. Again, PMMA mostly is not really a hydrogel material. This is mostly used for um, giving some structural, giving some conduit there as well. So you can replace it, but ultimately, especially if you want the function of the bone to be restored immediately at the time of surgery, at the time when this thing is being implanted, you would have to use the metal implant, as you mentioned in the comment as well. Okay, so there's one more question in the chat, again from Shantanu. So this says, in osteoporosis, implants often fail as screw loosen due to poor bone anchoring. Surface coatings, example hydroxyapatite, bisphosphonates, are limited since grooves disrupt uniform coatings. What if we design a drug eluting screw, a hollow screw filled with bone healing drugs, where an osmotic agents control sustained release through a small outlet. This could provide a fixation plus localized therapy. What challenges mechanical might arise, and has similar work been explored in orthopedic biomaterials? Right. So I think this is an interesting concept. Yeah, you are right. I think in osteoporosis, especially because the bones are quite weak, in general, the body environment is such that there's more osteoclast activity, the one that tends to degrade bone a lot more rather than osteoblast activity, which are the cells that are more involved in bone deposition. So if you have an osteoporosis, often these patients do have these problems that if they have, let's say, a fracture, they get some kind of metal fixture, some screws, some plates. Those are not integrating very well. They become loose as the bone is quite weak. And again, in those patients, these coatings, as you mentioned, hydroxyapatite bisphosphonates are being used quite a bit. I mean, these coatings actually work fairly well. It's not like that they don't work. Even for complex geometries, people have developed all kinds of methods of coating these things. So currently in clinics, they're being rampantly used, and of course, people are benefiting from them quite a bit. Having said that, obviously, if there's a new technology that can help it further, it's always welcome. In terms of the idea that you have been proposing here of drug-eluting screw, so generally the metal, it's sort of hard for me to comment on this very easily, just because I'm not really too much into metal research. But from whatever I have read, there's hardly been much approaches to make extremely porous metals, mostly because, as I think you've alluded also yourself later on, the strength of the metal sort of lies in the crystal structure, and if you start making it porous and all, the metals may not have that much strength to support what they were supposed to do, and especially in a challenging environment as osteoporosis, where they need to have quite good support wherever they can get a good addition with the bone. This could become slightly challenging, but nonetheless, if somebody is designing very nicely porous and good support beam structures within the screws, good support stresses to allow the forces to go through, then there's no reason why it cannot be filled with a drug-eluting drug and be released. Generally, I think the way the field is perceiving some of this is because if you really want drug release, obviously you could come in with other kinds of polymeric materials where you have a lot more control on the release rates on all kinds of drugs, as opposed to perhaps with metals, it may not be as tunable as you can get with polymers. But again, as I said, these are all hypotheticals. If you are able to design a system that is able to do what is the need for that particular application, for that particular condition, the idea otherwise sounds fairly reasonable. And yeah, I don't really know if something like this has been done before, but again, I'm not really been very well versed with this literature. Okay, I think let me see if there's any questions on the YouTube. Okay, nothing there as of now. Yeah, so again, if you guys have any more questions, please go ahead and continue to ask. Either again in the chat or on the YouTube channel or through the form, and we will be happy to take them. You can also, if you're here, I think 3-4 of you are here. If you want to just unmute yourself or raise your hand, we can take your question as well. Okay, while we're waiting in the meantime, Saksham, you want to introduce yourself quickly?
Yeah, sure. Hello, everyone. I am Saksham Jain. I am the TA for this course. I am currently doing my PhD in Department of Bioengineering from IST, Bangalore. And I am currently working on developing a delivery solution for delivering bacteriophages, which are basically viruses which can infect bacteria. They can be used to treat various bacterial infections, and I'm trying to treat TB using them. Yeah, that's much about my work.
Thank you.
Good morning, sir. Myself, Shantanu Jakote. I am student of M.Pharm Pharmaceutics second year at MIT World Peace University, Pune. Currently, I am working on development of core cell hydrogels for orthopedic implants.
Okay. Hi, Shantanu. Good to hear from you. Do you have any more questions as of now? Okay.
Sir, I would like to know about the feasibility of gel in gel system. Can we utilize the a solid gel which has outer layer which is like swellable, which has swellable matrix, and we can put a solid like core shell inside another gel like which has shrinking polymer in it. So can we develop such type of system?
Right. So I think okay. Maybe I'll answer some of the question that I understood, and maybe you can clarify further if I missed anything. So again, when you talk about hydrogels, we're not really talking about solid structures as such. These are sort of viscoelastic structures, which means that they'll have both elastic component and viscous component. That they're not going to be solid as, let's say, wood or let's say your metals. So certainly, again, the gel in a gel has been used quite a bit in the research field. For example, if let's say I have a gel system that is extremely good for a particular application, for particular properties, but maybe one or two properties are not really aligning very well with the gel, then a lot of time what people do is they'll blend it, they'll make a gel in a gel system, an interpenetrating network that would bring in another gel which has suitable properties in that one or two domains that your ideal gel did not. And hopefully the combination of that now will have much better properties for everything that you're trying to do. Of course, it also comes with some drawbacks that you may have bad properties now for two of them. So those may get highlighted even more. But nonetheless, it's sort of application based where you're trying to see if combining two things are going to give you better properties overall for that particular disease, for that particular application. So that's sort of your interpenetrating gel in a gel. When you talk about a core shell structure, there you're talking about that there's a good segregation. The core is one, the shell is of another type. So you could also have gels in both core and the shell. The shell, of course, will not be solid. The shell, of course, will also be viscoelastic if you're making a hydrogel, or you can encapsulate a hydrogel within some kind of a more solid material, which may not be a hydrogel, but may be some other kind of an implant that one can think of. Again, both of these are feasible. Depends on what you're really trying to do. Why do you need gel in a gel? Why just a single gel is not enough? Or why just an interpenetrating gel is not enough? So if there's a good justification of using two separate gels together, you can certainly think about it. And then, of course, that could also be quite novel. But then it has to be well justified with the application to go with. Did I answer your question? Was there anything else that I missed in your question, Shantanu?
No, sir, that was sufficient.
Okay. Okay, so I think again I'm not seeing any questions anymore. So we'll wait for another maybe 5-6 minutes to see if there's any other questions. If there are any questions, I'm happy to take them now. If not, then obviously there's discussion forums where students are, the TAs are there to help out. I think there's a question on YouTube saying, what are we talking about? I'm late, sorry. Okay, so I think this is just a NPTEL live session. We are just trying to take any queries that people may have if people are taking course of drug delivery on NPTEL. So if you're taking that course and if you have any questions that you would like me to answer, I'm Rachit, I'm the instructor of the course. I'm happy to do so. So please post your question either on the YouTube chat or on the Zoom link or in the Google form that was circulated earlier. Okay, we are still waiting for the questions. If you have any questions, please feel free to either ask or post in the chat. We'll be happy to take them. As I said, we'll maybe wait another 3-4 minutes to see if there's any more questions that are coming in. I hope you guys are enjoying the course and finding it useful, either in your research or in general. And obviously, good luck with the exams. As long as you follow the slides and lectures and understand them, you should be able to do well. Okay, I guess if there are no other questions, then we can end this. Thank you all for joining. NPTEL team, can we end this now?
Yes, sir.
Okay. Thank you. Thank you all. See you.